Hello, this is Khadijah Harris, and today I'll be performing patient transfer and positioning. First, I'm going to gel in, perform my hand hygiene. Hello, my name is Khadijah Harris, and I'll be your student nurse for today. Can you state your name and date of birth for me?
Please, 032699.
And I'm going to perform on his medical bracelet that is correct. I've already assessed his medical records to check for joint mobility, muscle strength, contractures, and any paralysis. And he has full joint mobility, and there are no signs or indications of paralysis or any of that. And I have determined that he's ambulatory, so there will be no need for a mechanical lift or any other members of the healthcare team. Do you feel any weakness or dizziness when you stand up or sit up?
No.
Okay, and can you raise your right hand in the air for me? Okay, and can you lower it? Can you raise your left hand in the air and lower it? So I've assessed his cognitive ability to perform physical actions. Do you have any pain anywhere? No, so there's no need for any pain medications 30 minutes before. So I'm going to put my gloves on. So today what we'll be doing, I'll have you sit on the side of the bed. Then we're going to transfer to the chair using the stand and pivot method. And after that, we're going to perform some range of motion exercises so that we can determine the flexibility of your knee. So now I'm going to have him to sit off on the side of the bed. I'm going to assist him. Okay. And then I'm going to have you scoot up some. All right. And then I'm going to go under his arms to use the stand and pivot method. Sorry. All right. And on the count of 3, we're going to stand and pivot to the chair. 1, 2, 3. Pivot. And he's going to have a seat. And then I'm going to have him sit in a relaxed stance with his knees. And we're going to perform flex first. So I'm going to have you to scoot your knees back, your legs back, just like that, heels on the floor. Now scoot it back as far as you can. And now I'm going to have you to extend this leg up and hold it for 5 seconds. 1, 2, 3, 4, 5, and you may lower it. And now with the next leg, 1, 2, 3, 4, 5, and you may lower it. And then could you push this foot back, heels on the floor? Okay, now go back to a relaxed position. Okay, so he's just performed flexion and extension of the knee. I assessed his blood pressure before completing this exercise, and after putting him back in the bed, I will assess his blood pressure again. Again, he has on non-skid footwear, which was placed before we put him in the chair. All safety precautions were taken, and privacy was provided. Now I'm going to remove my gloves and perform hand hygiene. And now I'm going to document my patient's pain and tolerance for this exercise.